Hi everyone. I am doing a VI Peel Precision Plus on Heather today. Some of her concerns are she has some pigmentation just from sun damage from years ago. She also has a little bit of melasma. Melasma, we call it a pregnancy mask. You might hear that term. It does look kind of like more patches of brown as opposed to like brown freckling. Kelly, if you want to get closer, we can actually show you what melasma looks like. If you look here on Heather's forehead, you can see this little brown patch that's right here. That's kind of the most noticeable patch that she has. Some people get it across their lip area. Some get it on their cheekbones.
And I do have it like across.
She does have a little bit here. This one's probably just the most evident to show on the camera. But I love the VI Peel in general. It has a proprietary blend of acids that really target pigmentation, fine lines, evens the skin texture. The Precision Plus that we're doing version of the VI Peel has hydroquinone, which is a bleaching agent, which really targets that pigmentation even more than just the regular VI Peel. So I like it when I really need to blast out that pigmentation. So we're gonna do this on Heather. I actually already cleansed her once and took some pictures so that I have before pictures of her. I'm gonna cleanse her one more time and then we'll go right into the peel. And I kind of kept everything in its packaging just so you can see all the different steps and what's all involved in doing the peel. Get some gloves. So I love the VI peels. They're pretty quick to do, usually take about 15 to 20 minutes. The patient, it actually has a little bit of a numbing agent in it, so as far as discomfort, it's not that uncomfortable of a peel. Okay, so I'm just going to cleanse her here. So we took the before pictures of Heather, and we're going to keep taking progression photos to show you. It'd be really good if we can take them while you're peeling, so we can show how that peeling looks. With the VI Peel, especially the Precision Plus, and really with any VI Peel, you really do peel a lot. Some patients, if their skin just doesn't need to exfoliate as much as someone else, they might not get as dramatic of the peeling afterwards. Others almost peel like a mask. So I'll be anxious to see how Heather does. Kind of rub a little bit harder because I really want to degrease the skin, even though she's not greasy, but we call it degrease the skin, so that way the peel can really penetrate. Okay, now I'm just going to rinse that off. I love chemical peels. I've been doing this for 18 years just about, and we can do all different levels. We can treat anything from acne to fine lines to pigmentation to just uneven skin texture. We can just really address a lot of concerns with the chemical peels. And for somebody that doesn't want something maybe as strong as the VI Peel, there's a lot of different options out there.
In here.
Well, yeah, in here, but I mean, there's a lot of different options in here. This is a post-peel or a prep towelette. Doesn't want to break for me. So this is the prep towelette. And again, this is just going to really prep her skin so that way the peel can really penetrate. So it's all part of cleansing and then doing the towelette. right over the eyebrow area because she has some pigment that runs through there. Only time that I wouldn't go over the eyebrow area is if somebody has had permanent makeup or microblading, because I don't want to take that color out too fast. Because it really does with the exfoliation, when you have like a semi-permanent ink in there, it can speed up the process of it coming out of you a little bit sooner, so it's just better to avoid the eyebrow area if you've had permanent makeup. Do you care if I go over that?
Mm-mm.
Okay, so Heather had a surgery not long ago, and she has a little bit of a scar from where it's healing. You can see it on your neck area here. So I'm going to go over that because the peel will also help to soften that and kind of speed up her tissue healing, so that way we can hide some of that discoloration that's there and help to flatten that area out a little bit. It's such a small scar, so it's not going to be too much to even that out a little bit. All right. So the first step with the VI peel is actually putting the VI peel itself into the little cup, so I'm just going to be doing that. Different gauze to apply it, so just getting that out here. Okay, so now I'm going to put one light layer all over her face, onto her neck, and over that little scar. Like I had said before, this has a little bit of a numbing agent in it, so it will feel a little burny, tingly for maybe about 10 seconds, and then she's not really going to feel anything.
And that one's the one with the booster.
This one, I'm gonna put just the light layer on first,
Okay.
get you numb, and then I'm gonna put the booster in. A very light, even coat. Now I'm going to add the booster. Now, like I said, the booster has just a little bit of a stronger acid combination, and it also has the hydroquinone in it. How do you feel?
Good.
Good.
Feel a little
Warm.
a little tingly, but nothing.
Good. So now I'm really just going to work this in. Really work it into where she's pigmented. I really want to use all of the solution that's in this cup, so that way she gets full results. Now, some people will say, well, well, if you have any left over, can you put it on my neck or my chest or my hands? That's really not the best to do, because we really want, this measured amount is what is meant for the face area. So if you spread it out too thin and don't use as much on the area that you're treating that you should be using, the results won't be as good. So. Still feeling okay?
Mm-hmm.
Good.
Yeah.
So the redness that we see on her skin right now, it is a little bit of flushing, just from, you know, feeling that heat that she felt in the beginning. But it's really, if you can see the color of the VI peel, that color really does make it look a little more red too. So it's not, you know, she looks pretty good right now. A little bit pink and has that little brown tint to it. Some people get more red than others, just depends on the person. Now Heather does have a couple little areas that I just want to do a couple extractions. So I'm going to leave a little tiny bit left in this cup so that I can just go back and dot over top. Everything ready for my extractions here. Okay, so I'm going to do some extractions, and what extractions are, she has just a couple clogged pores. You know, Heather doesn't have acne, but she does have just a couple little clogged milia, I call them. They're kind of like a white little bump. If you zoom in here, I know her skin's kind of reddish brown from the peel, but if you can see this white little dot right here, that's a milia. That one's just very easier to see. So that's what I'm going to actually pull out right now. So it's a two-step process. One, I'm just going to put a tiny little puncture into the skin, and then I'm going to go in and just pull the little milia out. So I put the little tiny puncture, and now I'm just going to go through. And then you can just see it's just that little white dot that I pulled out. So, and then I'm just gonna, there's a couple on here. Heather has really good skin, but she does have very tiny pores. So with those tiny pores, they can clog just easier. Doing okay, Heather?
Mm-hmm.
is important, you know, not to pick the skin yourself. It is really hard to get these kind of things out on your own. And you know, you really have a higher risk of scarring and having problems. And as you can see, you know, when we do it or when I'm doing it now, you know, there's hardly any mark there. It's going to heal extremely fast. In the cheek area here, there are some more blood vessels, so sometimes it'll bleed just a little bit. Totally normal. And almost everybody has a couple little clogged pores on the nose. All right, so I'm just going to put a tiny bit of the peel just dotted on the areas that I extracted, just so that way I get a little bit more of the peel back into those areas. Okay. Now, as far as the VI Peel Precision Plus, she is really done. She doesn't need anything else put on. Now, if I have a patient that says that they're going to be outside walking or gardening, I would put the sunscreen on because I do think it's important to wear sunscreen every day. But I also prefer not to put the sunscreen on if they're not going to be outside. Because then the peel really, really, really gets to penetrate, and that's super important. So at her aftercare with the VI Peel, it's actually a combination of a cleanser that she'll just use her normal at-home cleanser that she gets from us that I would recommend for her for afterwards. And then she'll have a sunscreen, she'll have a post-peel protectant. The post-peel protectant is like a thicker moisturizer that when you start to peel, which usually the peeling begins about 2 days after today, she'll be able to use that to kind of help soothe the skin. Some patients have a tendency to try to rub a little bit, and that is a bad thing because you don't want the skin to come off too soon. So the post-peel protectant kind of keeps you from doing that because it just keeps the skin really hydrated and protected. There's also pads that are little towelettes that have special steps of when to use them. She'll use one tonight. After she washes her face, she'll use a towelette. She'll use the protectant just if she feels a little itchy or feels a little dry. She can also use her normal moisturizer that, as long as it's one that we recommend that she uses. I know Heather likes the collagen boosting hydrator. It's one of my favorites. That would be fine for her to use tonight if she just feels a little dry. Otherwise, she can just do the towelette and go to bed. The next morning, she'll cleanse, do the towelette, she'll put her sunscreen on. Then she's going to start to get kind of tight and taut feeling A lot of patients will say, I feel it really tight around my mouth area. That's usually where the peeling starts, and it kind of works to the outer edges. So she'll have just kind of like a couple day step as far as cleansing, using the towelettes, and then using the sunscreen as well. And then about 4 days from now, her peeling is going to be just kind of really on the outer edges, and then that 5th and 6th is just kind of finishing those little kind of outer edge residuals that are left, and then she's back onto her normal routine. Patients will say with the VI peel, especially the Precision Plus, their skin might look a little darker for a day or two until they start to peel, and then that peeling just starts to occur. So, you know, can you go out and look normal, you know, so to say? Yes, you can, but you don't really want to put makeup on because the makeup kind of accentuates that peeliness. So a lot of times patients will come into me like on a Wednesday or come into here on a Wednesday if they want the weekend to peel and nobody knows that they had anything done. Others will have the peel while they're at work because they don't mind that they look like that at work and they don't want to look like that on the weekend. So it really depends on the individual's preference. Anything else that you can think of to add?
No, and everything, there are a couple steps afterwards, but everything is laid out in...
Yeah, and we go through that with you individually. I mean,
It's super easy to follow.
It's super easy.
Mm-hmm.
Heather will have a couple more steps because of the Precision Plus being in there. It's just 2 more towelettes that are added. But again, we go through, we give you a little book. It shows you, you know, exactly what needs to be done afterwards. So I'll just show you here just as a kind of a little, it just looks like this, and it actually gives you your steps on what to do afterwards, and we walk you through this. So we don't just give you the post kit and say, here you go. You know, we really walk you through what to do afterwards.
Yeah. No, that's it. And I feel great. I mean, I don't know what I look like right now, but I feel fine. I mean, nothing.
Days.
And can't wait to see the final results.
Thanks, everybody.